Hi there. So my PICO question actually involves for a population, it is uncontrolled rates of atrial fibrillation post-operative cardiac surgery. The intervention is treating patients with amiodarone. Initially, I started off with digoxin. After appraising the evidence, I realized that that was out-of-date information. However, it is what is currently being practiced at the New Brunswick Heart Center. So after gathering all of this, I'm able to kind of bring that to the table. My comparison ended up being digoxin versus amiodarone. And the outcome was either controlled rates of atrial fibrillation, a conversion to a normal sinus rhythm, which of course is optimal, and providing medical management and support to the patient and the family members. I thought that this was an important topic because after regular bypass, the incidence of AFib is 5 to 40%. And adding in a valve replacement to that actually brings that percentage up to 64%. So it's pretty prevalent. So the first way was incorporating the nurse, which is kind of what I focused on. And so the beginning was symptom management. You can feel like you are lightheaded, dizzy, fatigued. Anxiety is a huge factor. People don't understand what's happening. Shortness of breath, also because the atrium is quivering, you can have lower blood pressure and potentially go unconscious. So I thought it was important to either administer the antiarrhythmics, administer the anti-anxiety medications, place O2 for comfort if the patient is short of breath, educate the patient and the family, and of course provide reassurance. So in regards to administering the antiarrhythmics, that kind of brings it back to either digoxin or amiodarone or the facility's medication of choice. It's still really up in the air. I was hoping by the end of my PICO assignment that I was going to have an answer, however I don't. Second way of incorporating the nurse is to use the best possible medication history. When patients come in, potentially maybe they're already on an antiarrhythmic or they have pre-existing comorbidities that might lead them to fall into a rhythm after heart surgery maybe more often than somebody else. Age also plays a huge factor. Actually, they said that within each 10-year increase in age, it jumps your incidence of AFib by 75%. So another way of doing it would be for the nurse to use a preoperative risk assessment maybe sheet, and age and history of atrial fibrillation could be incorporated, and maybe the surgeon would be made aware so that things could be put in place before surgery or soon after, such as one of the information I found was to use a beta blocker actually immediately post-op to decrease the incidence. So anyway, lots of stuff coming up. We'll see. Thank you.